everyone. It's good to see all of you guys here in attendance today. I was so honored to be able to speak to you guys about what a nurse practitioner does and what they can bring to the table for an interdisciplinary team. I am so happy that you guys have allowed me to join your fine practice. And I'm so glad to see all of the students from the College of Southern Nevada here to learn more about the difference between what a nurse is and as they progress in their education to what is the difference between a nurse and a nurse practitioner. The American Nursing Association defines nursing as someone who protects and promotes and provides optimal health, prevention of illness and injury, facilitation of healing, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individual family groups, communities, and populations. So for those nurses who have joined us here from the College of Southern Nevada, you are starting on your path to becoming a nurse. You're going to be providing patient care and promoting, advocating for your patients. You're going to be caring for them. You're going to be administering medications. And the good thing about obtaining a nursing associate's degree is you're going to learn more practicum experience. As you progress and as you move on to your bachelor's degree, you're going to learn more about taking the next step to leadership and more community service and more community advocacy. If you guys choose to, there's several different paths. You can choose to get your master's degrees. For me, it was nurse practitioners. And according to the American Association of Nurse Practitioners are becoming the healthcare partner of choice for millions of Americans. I think that's wonderful because as clinicians, we can blend our clinical experience in diagnosing and treating health conditions with added emphasis on disease prevention and health management. That's huge because currently there are so many people with diseases. We could be out there promoting obtaining your flu shot. This year the flu is so bad. Today I just went to my family friend's funeral. He just passed away from the flu. So, I wonder if maybe that flu shot could have helped prevent him from passing away. Nurse practitioners bring comprehensive perspective of health care. What sets nurse practitioners apart from other healthcare providers is their unique emphasis on health and being of the whole person. They focus on promotion of disease prevention and health education and counseling. Nurse practitioners guide patients in making smarter health care and lifestyle choices. They focus on health promotion and disease prevention. They also help with health education and counseling. Nurse practitioners guide patients into making smarter health and lifestyle choices, which in turn help lower the out-of-pocket costs. For me, I know medical costs are astronomical. My husband's a type 1 diabetic, and just to keep him alive, insulin, it's outrageous how much it costs. With insurance, it's $760 for 3 vials of Humalog. Something has to be done. Nurse practitioners, they offer high-quality, cost-efficient, patient-centered health care. Nurse practitioners provide more than 234,000 solutions to primary care shortage. So that's really great because currently we all know it takes months and months to get in to see a doctor. With nurse practitioners, you can make an appointment and get seen. The nice thing is that people or patients are very happy with the care they get from nurse practitioners. Nurse practitioners They provide a full range of primary care in the acute or specialty healthcare services, including they order and perform tests. They interpret diagnostic tests such as lab work and x-rays. They diagnose and treat acute and chronic conditions such as diabetes, high blood pressure, infections, and injuries. Nurse practitioners can prescribe medications and other treatments. They manage patient overall health care. They counsel. They educate patients on disease prevention and positive health lifestyle choices. Nurse practitioners, they can work in any area from acute health care, adult health, family health, neonatal health, oncology, pediatric and child health, psychiatric, women's health, or they can specialize and work in allergy and immunology, cardiovascular, dermatology, emergency. They can work with pulmonary and respiratory. The areas nurse practitioners can work with is unlimited. For me, I became a nurse. I'll tell you a story. When I was 7 years old, I was walking home with my sister. She fell down and she hurt her knee. It wasn't a bad cut, but she was bleeding and she was crying. She had those big alligator tears. So I brought her home. I cleaned it up the best a little 7-year-old could do, and I put a Band-Aid on her knee and kissed her better. From that moment on, seeing the smile on her face, I knew I wanted to become a nurse. And I worked hard to get there. There are two theorists that I really admire and I really try to follow in their footsteps. One of them is Florence Nightingale. She's like my hero. Without her, I think it would have been a long time before we saw some improvement in healthcare. Florence, she was amazing. She changed nursing. She changed healthcare. She determined that people needed to wash their hands. They needed to have clean water, clean bedding. They needed to change the bandages. They needed to make sure that patients had a normal temperature, not freezing cold, not too hot. She did everything she could to help change the lifestyle of people. Back then, it was kind of like a death sentence when you were sent to a hospital because of the uncleanliness, or even in the war she was in. People who got hurt, a good majority of them died just because of the dirty conditions. So how do we take her theory and move it towards today? Today, in the hospital, many people get what is called central line associated bloodstream infections, or they account for as many as 28,000 patient deaths annually in the United States. That's according to have it abbreviated, AHRQ in 2014. To help reduce these statistics, medical staff members should be educated on how they can reduce these infections. People need to have reinforcement and re-education on the interventions for proper hand hygiene, the use of chlorhexidine skin preparation, and maintenance of sterile field when inserting the line, and full barrier precautions during central line venous catheter insertion is a great way to help reduce these infections. Establishing and implementing a checklist to be followed for every central line insertion is based on evidence-based practice, which will help ensure the proper steps were followed for insertion. Establishing an agreement between physicians and nurses that nurses will be at bedside to encourage physician adherence of these evidence-based practice guidelines will help reduce patient infections. The overall patient goal, of course, to prevent these infections is 0 infections and no patient harm. These will be achieved by following the above-mentioned evidence-based practice guidelines. So these, my hospital is currently working on focusing on reducing these infections, especially CODI infections. CODI infections are catheter-acquired infections. It's actually our 7th goal, and we're working hard with the Joint Commission to reduce these infections. The hospital is, they've even bought new urinary catheter insertion kits, and they've educated everybody on the importance of hand hygiene and the importance of peri-area cleaning to help decrease these infections. The last day I worked, I was really pleasantly and happily surprised that it has been 173 days since we've had an infection from CODI. And it's been almost 200 days since we've had a central line infection. So we are following in Florence's footsteps. We are doing hand hygiene, and we are implementing these procedures to help reduce these infections. We are committed to patient care. We are committed to working as a team and decreasing infections. I know another theory that I believe nurses and nurse practitioners adhere to. It's called, it has to do with an article that I read entitled Making Good Better, a proposal for teaching ethics at the service of academics, and it was written by Deanne Peter Baker. This article addressed mandatory ethics in the military content, with particular reinforcement on service academics of the United States Army, particularly midshipmen and cadets. During their education, they are taught about deontology, or the study of duty as an approach to ethics that focuses on duties and roles. This interdisciplinary deontology is an ethical approach for the United States Armed Forces, and it can be applied to healthcare workers. In both fields, individuals must possess moral sensitivity, defined by REST, the awareness of how our actions affect other people. Individuals must possess moral judgment and the capacity to determine which course of action is morally justified related to alternatives. Once individuals have determined the right action, they must demonstrate moral motivation and prioritizing moral values over others, potentially self-serving values. So I think nurses are the same as our wonderful armed forces. We have these ethical values. We treat our patients with respect. We, like our wonderful armed service, go above and beyond to do all we can to help our patients. That's why I think we are so similar to the military, because of the ethical values that we share. One theorist that I totally love, I totally relate to, is Miss Jane Watson. Her theory of human caring is how I have always based my nursing career. I truly care for all my patients. One story I can share with you is about how I had a patient, and she had been beaten and abused by her significant other. She had broken ribs. She also was kicked out to the curb, to the streets. She had a black eye. She was very frail, and she could not care for herself. She had lice. So, and it was a really bad case of lice. So the thing that we did was we worked as an interdisciplinary team, and we worked to get her situated in a women's shelter. We kept her one additional night because the discharge came so late. We also, a nurse obtained her clothing. I worked with the social worker. I worked with the case manager. We got her numbers for support if she wanted to press charges. We got her clothing. We obtained a brand new coat for her. We got a bus pass for her. We did everything we could. We worked so hard so that we could make sure that we did everything to help this lady become successful. An article that describes nursing as a caring profession and a caring perceived by vital in promoting successful patient outcomes was by Desmond Horn, Keith, Kelby, Ryan, and Smith in 2014. They explained that when caring was evident, patient had enhanced self-esteem, qualities of life, knowing and coping mechanisms, as well as described decreased lengths of stay and health cost and uncaring situations. Patients felt humiliated, vulnerable, and frightened as they experienced decreased healing as well. Nurses employed in caring cultures felt accomplished, purposeful, grateful, and satisfied with their work, and even displayed enhanced clinical judgment. And uncaring environments, nurses become hardened and depressed. So I'm so glad that the nursing team that I work with was not like this. They don't feel hardened. They don't feel depressed and warm. There was an article, and it was by Davis Tamayo, and it was entitled "Because Someone Cared About Me, That's How Things Changed." And so that's how I want that patient, hopefully her outcomes to be, was similar to those people that the case managers and social workers went around and helped them. I want her to know that our interdisciplinary team cared about her, and I hope that she can make those changes in her life to let them know to be productive, get a job, hopefully get a house, and not continue her drinking. I hope she knows that we truly cared about her by obtaining all those belongings, making all those arrangements, getting her a bus pass and a coat. We didn't just kick her to the curb. We took care of her, we protected her, and we did everything in our power to help make her successful. I know for me as a nurse and a new nurse practitioner, I want to let my patients know that, like Jean Watson, I truly care about them. I want to be the best nurse that I can be. I want to be positive. I want to support my patients. I also want to let them know that I'm there for them, because that's what I think nurse practitioners can bring to the table. Yeah, they are a great resource for patient care. Nurse practitioners, I think, have that quality of caring that Jean Watson's theory has. They have the know-how from Miss Florence Nightingale's theory of how to make good changes, how to do something as simple as wash your hands. They know how to use evidence-based practice, and that evidence-based practice makes a huge difference in everything. I know for me personally, my personal philosophy to nursing that I can bring to a table as a nurse practitioner, is my goal is to treat every single patient the way that I would want my family member to be treated. I don't want my patients to feel like they're not valued, they're not important. Without my patients, I wouldn't have a job. I want to have that feeling I felt as a little child when I kissed my sister's knee and I made the boo-boo go all the way, made her better. That's what I bring to the table as a nurse practitioner. That's what I bring to your team. That's what I want you, CSN students, to try to instill in your core. Nurses are important. Nurse practitioners are important. Case managers, social workers, respiratory therapists. We are all there. We strive to take care of our patients. We try to give them something that makes them feel better. And if we can't, we try to be there for the family. Just this past week, I lost my husband's cousin. And I'm going to give you one set of advice that he gave me. And it was, excuse me, remember my blood type. It's B positive. And that's a new value I'm going to instill in my nursing practice. And I'm going to be positive. I'm going to be positive that as a nurse practitioner, I can make a difference. That's my goal. Thank you.